Gary, it's 12.
Okay. Thank you for joining us today. This is another session of our set of Lunch and Learns. Our Lunch and Learn in August focuses on Section 504. Our guest speaker is a member of the DER Executive Committee, Malia Jensen, who works in the Office of Hearings and Inquiries, OHI. She'll be discussing a PowerPoint presentation, in this case for managers, about Section 504. I'm Gary Norman. I have this year the pleasure to be chair and to try to broker some conversations on accessibility. The DERG is an ERG at CMS that seeks to broker informal solutions as well as provide a voice on accessibility issues of employees with disabilities, managers with disabilities here at the agency. Without further ado, I hand it over to Malia. Thank you so much for speaking today.
Thank you, Gary. As Gary said, I am Malia Jensen, and I am part of the Customer Accessibility and Resource staff in the Offices of Hearings and Inquiries here at CMS. And before I jump into the presentation, I want to go over a couple of quick housekeeping things. First of all, if you are joining us on the phone, we are going to have an opportunity for everyone to ask questions, but for right now, everyone is muted. That's just to cut down on the background noise, and we're going to open up the phone lines at the end and give everyone an opportunity to ask questions. This is a relatively quick presentation, and so there'll be plenty of time for everyone to get their questions in. Also, if you would like a copy of the presentation, please send an email to susanna.lang@cms.hhs.gov, and she'll be happy to provide you with a copy of the presentation. And we'll give maybe just a minute for some of those emails to come in, and then we'll get started. So just a little bit of background. As many of you might know, CMS is mandated by several laws to ensure that our programs and services are accessible to individuals with disabilities. And these laws are the Rehabilitation Act of 1973, Section 504 and 508, and Section 1557 of the Affordable Care Act. Today's presentation is going to focus mostly on Section 504, and there are many facets to Section 504. However, today we're going to primarily focus on external communications with our beneficiaries and how what is required for us as CMS employees by Section 504. So communications accessibility responsibilities apply to all beneficiary programs. No matter if they are currently part of a CMS program or not. Internal, external, basically anyone who reaches out to CMS for any kind of information regarding any of our programs. And of course, you know, our goal is ensuring that everyone gets the information that they're looking for in a timely manner. Next. Section 504 and 508 of the Rehabilitation Act complement each other to promote accessibility. Section 508 calls for accessibility, to be accessible, or bleh, sorry. Sometimes I talk a little fast and I get ahead of myself. So Section 508 requires information to be accessible when technology is involved. Section 504 calls for information to be accessible regardless of technological tools. You might have a website that's accessible, but you may need a beneficiary or a consumer may still need the information in another format. For example, if you put out an annual report on your website and a beneficiary wants that report in Braille, under Section 504, you would be required to provide that report to that beneficiary. And there are some additional, in the resources section of the presentation, there is that example and another example. I pulled that from the HHS website on Section 504. So you can, like I said, it goes into a little bit more depth on that. As all of you are hopefully aware, each of your components have a Section 508 clearance officer, and we have also included the Section 508 clearance officer list in the resources section of the presentation as well. Next. So CMS offers a variety of auxiliary aids, and I'll just go through a couple of these for persons who are blind or have low vision. They might be audio or data CD or documents in Braille. For persons who are deaf or hard of hearing, sign language interpreter or Fed relay. And then we also offer other auxiliary aids to cover various other disabilities. And you know, the definition of auxiliary aid is on the slide, but it kind of, based on the descriptions that I just gave, it's kind of self-explanatory. Basically, they're just anything that helps a person with a disability participate equally in a CMS program. The most important thing, we should be on the auxiliary aids continued, correct? Mm-hmm. Okay. The most important takeaways about auxiliary aids are these. One, we don't require beneficiaries or consumers to prove that they have a disability in order to receive an auxiliary aid. We don't charge for auxiliary aids. And it's important that these aids are provided in a timely manner, as they could have timing and protection consequences for the beneficiary or consumer, and also consequences for the agency if these aren't provided timely. Next. So if you receive an individual request, first of all, get the individual's contact information, name, phone number, email, and try to find out what it is that they're asking for, what publication, what form, and share that information with the CARS team. You can also share our contact information, which is coming up in a couple of slides, if they would like to reach out to us directly. Next. Just a couple of things to keep in mind when you're designing communications for the public. Try to think about how what you're creating could be turned into an accessible document. How will this chart, would it easily translate into Braille? Would this colorful document be something that if someone with low vision prints it in black and white, would it print well? Would it be something that's easy to read? Or if, would your colorful document be something that's easy to read if it's printed on a color printer for someone with low vision? So just some things to keep in mind, but these aren't things that you have to figure out all by yourself. The CARS team would love to partner with you to help you create a communication plan and to answer your questions on how to make sure that you're in a good place to be able to make your documents accessible for the beneficiaries that you serve. Next. So here is CAR's contact information. We don't have any particular individual on our team listed. These are the numbers and email address to our alt format channels. The analyst of the day checks these several times a day. And so no matter, you're always guaranteed to reach somebody. And if they don't know the answer to the question that you're asking, they can certainly find it for you. Next. And then employee reasonable accommodations. The CARS team is not the group here at CMS that handles employee reasonable accommodations. That function lives in the Office of Equal Employment Opportunity and Civil Rights, and their contact information is on the screen, their phone number and email address. So if you need to get in touch with them to request a reasonable accommodation, you are welcome to do that anytime. And that is everything. Like I said, it was a super quick presentation. And so now we are going to open it up for questions. We'll start with the folks in the room. Does anyone have any questions? Take that as a no. Awesome. Let's see. Are we still? Are the phone lines still muted?
Yeah.
Okay. Can we unmute so that our folks on the phones can ask questions?
Daniel, can you unmute, please?
Sure, I'll unmute the line at this time.
Thank you.
All lines are now unmuted if you have any questions.
Hi, this is Arlene Austin, and I have a question with regards to Section 508 and CMS compliance.
Sure, go ahead.
There are a number of pop-ups that CMS has whenever you log in, and those pop-ups are not 508 compliant with regards to color ratio. And I'm curious as to what would be the avenue in which one advises CMS to change any format that they have in their, audiovisuals as they design and put them on the computers for their employees.
That is a very good question.
Yeah, I would suggest contacting Aaron Allen. He's kind of our Section 508 advisor, and then B, reach out to your individual Section 508 coordinator for your home.
What is the name of the person?
Aaron Allen.
Okay, thank you.
Thank you.
Yeah, he was on the last call. I guess he wasn't able to call in today.
Anybody else have questions?
Yes, hi, this is Anita Gleimer. I do have a question about the copy machines in the hallways, the network machines that scan, which now have voices and better controls, but are up way too high for anyone who is either height challenged or seated in a wheelchair on a scooter? Who would handle something like that?
I think that's the issues list that we're compiling for when we meet with the executive sponsor of DIRG, Anita.
Okay. Thank you.
You're welcome.
Other questions about Section 504 as it regards to external communications with beneficiaries?
Just as a comment, Malia, you explained it extremely well. Thank you.
Thank you. All right, well, it doesn't sound like we have any other questions. You guys, if you think of questions later, you can always send an email or call the CARS phone number. We're always happy to answer questions, so please don't hesitate to reach out. Thank you all for coming. We appreciate you taking the time to come and listen and learn about what the CARS team is doing and how we can assist your component to make sure that we're better serving our beneficiaries.
Thank you for the great presentation.
Good job,